Welcome to CharityVillage Connects. Today we're celebrating the winners of the 2022 CharityVillage National Awards. Joining me is CharityVillage Connects podcast interview with Hassel Aviles of Not 9 to 5, the winner of the best contribution to workplace mental health. Congratulations.
Thank you so much. I'm so delighted to be here and very honored.
So, Hassel, I'd love to know more about your organization. It has an intriguing name. Maybe you could tell our audience of what is Not 9 to 5.
Happily. So you're right about the name, and that was done very strategically and intentionally. So I'll tell you a little bit about the name first, and then I'll go into kind of what we do. So Not 9 to 5 was named that because there is nothing that works with, there's nothing about mental health or the hospitality and culinary food service industry that works within those hours. And that is the sector that we mostly work with and for. And I have lived with mental health challenges my whole entire life. And during all of the time I worked in restaurants, no one ever spoke about this. And workplace mental health just wasn't a term that I was aware of at the time. And it's very, very, very still stigmatized in the world, but also particularly in this sector. So Not 9 to 5 started, I always say we're founded in instinct and cemented in data now, because it was very much started from my own personal lived experience. I'm one of the co-founders, and the other co-founder and I both had worked in the industry forever. And we just felt like we can't not talk about this elephant in the room anymore. It's in every bar, restaurant, hotel, etc. that we were working in, and not in a small way, like in a very significant way. A lot of the cliches and stereotypes that you see in TV, mainstream media about this industry are true, and also don't even show you half of it. So we both kind of came together, and initially we thought it was like going to be a grassroots local initiative, which is how we started. We have very small and mighty roots, but it very quickly has been, kind of pulled in so many directions. We're now a global leader in mental health advocacy for the food service sector. We have partnerships with many organizations around the US, the UK, and beyond. Every day we're growing new partnerships. Today I was talking to someone in Denmark, Copenhagen, that wants to do an event together in the new year. So it's definitely grown far beyond what I ever thought. And like I said, is mostly based on lived experience.
So what do? Do you put together resources for people in food services and the hospitality sector that might be struggling and wouldn't otherwise, in the kind of work that they do, have access to this kind of support?
That's exactly right, Mary. So like you would think that we would have more resources, but we don't. We just don't. And so that's why we that's why we started. That's why we still exist, is, in our industry. And so, for example, I'm in Ontario, so I'll give you an Ontario example, but this is true globally. Usually when you work with alcohol, you need to get some sort of certification. In Ontario, we call it SmartServe. And you need to get SmartServe certified in order to work with alcohol and sell alcohol and serve alcohol. So there's nothing like that in our industry for any kind of mental health support skills or any kind of substance use challenges support skills, even though the need is so high. So originally when we started, I really wanted to make sure that this wasn't just based on, like I said, instinct and intuition. I knew what I was seeing, I knew what I was feeling, but I wanted the data, I wanted the research. And when we started to survey our industry here in Ontario, we put out, and we had hundreds, like over 700 people filled out the survey. And even in the US, we had some American respondents. Do you live and work with mental health and substance use challenges? 90% said yes. So it wasn't some of us, it's most of us. And what we quickly realized is it's not an if you're going to need these skills, it's a when you're going to need these skills. So we wanted to better equip the workforce. And what we did is, in the last couple of years, thanks to federal funding, we've been able to create industry-specific workplace mental health certification. We have a certification course, and other content as well. So we've created other industry-specific resources, including guidebooks, webinars, like you name it. And it's funny because our name, Not 9 to 5, attracts a lot of different kinds of people. We've had healthcare workers go through our content and our program. We've had graphic designers, freelancers. So even though we wrote it for our industry, at the end of the day, everyone has mental health. So, our content is really for anyone, but we definitely included videos and audio stories that are specific to our industry with through a lived experience lens. And then beyond the resources and the content, we also, like, besides the practical education that we focus on, we also do a lot of community building as well.
Well, it's certainly, it makes a lot of sense going through the pandemic that the people in your sector were very challenged naturally on all fronts by the pandemic. Certainly, your services must have been extremely well received and very timely to have coincided with starting your organization and during this very, very difficult time. I wonder whether you could, comment on what do you think really made the difference in terms of being nominated and even winning this award for your organization generally? What was that special sauce, so to speak?
I will give you what I think. I mean, I wasn't on the judging panel, so I don't know why they specifically chose me. I can imagine why, just from my, opinion. And there were some people that told me that they nominated me. So I did, hear from them. And truth be told, I also nominated myself because I really felt like what I have done and what my organization has done, what my team and I have done is incredibly unique. There really is no one else, first of all, in our sector that's done this. It doesn't exist. You would think the government has like these kinds of programs, but they don't. And so I think what is unique about me and I guess the work we do is partially what I've already said, which is that it's based on lived experience, that I've managed to find a way to use my lived experience, even though a lot of it was painful and traumatic. I've been able to use it as a lens to create content that I know will resonate with the audience we're trying to connect with. It's not just opinion based. Obviously, everyone on my team comes from the industry, so we know all the little intricacies of what makes our industry different. But we also all have mental health challenges, and every single person's mental health challenge is different. And we've tried to incorporate as much of that lived experience into the program. What makes that unique is that most programs out there, whether they're CBT, DBT, whatever kind of therapeutic lens that you create mental health resources with, most of them are academic and clinical, and ours are not. We obviously had advisory and consultants that are mental health professionals, social workers, psychiatrists, always go through our content. We obviously want to make sure everything we're putting out there is sound and helpful, but first and foremost, it's coming through, we know what we need. It's by us, for us. So I think that's one of our unique differentiators. The other thing, too, is that I think what we're doing has resonated, like I said, way beyond our sector. So I think one of the biggest things is that it's also through an intersectional lens. We understand that everyone's lived experience is different, and we considered, the experience of a racialized person. We considered the experience of people of multiple different genders. We really tried to keep it as intersectional as possible. And I think that is also a big differentiator. I think a lot of times mental health content that's out there is really targeted from a specific lens and a specific kind of person. And we really kind of wanted to humanize it and create language that was what I call real talk. It's like, it's meant for anyone, basically that's like a high school reading level, like, can read this. I didn't want it to ever feel like too academic, even though it's just as powerful. And so, yeah, I just wanted to make sure it was as accessible as possible.
And I'd love to know how it made you feel when you found out that you won the award.
I mean, I don't know what other winners are saying. For me, I was initially shocked. I saw my name come up and I just kind of sat there with, I can't even imagine what my face must have looked like. You should catch winners and see what they look like. Because I was shocked. I was really shocked. I mean, there's the nominees that I'm up against. They were incredible. The work they do is incredible. I feel so honored and privileged to be amongst them. You know, there's a doctor on was one of the nominees. And so I was absolutely shocked. And then after the shock passed, I just felt very emotional. I felt very seen. I felt like all of this work, you know, to be recognized by Charity Village, to be recognized by your judging panel, to be recognized by my own community, it's an emotional experience. And I feel very, very proud.
And I'm curious whether you think that awards like these are good for the nonprofit sector, or the sector generally, and the professionals that work within them. What do you? I'd love to know your point of view on that.
I so appreciate this question because I think everyone must have a different opinion on this. Personally, I do think it is important. I hope that you continue to do these kinds of awards. I think it's recognizing, I mean, our sector is, you know, there's so many people doing such profound, incredible, impactful work. And oftentimes you're not recognized or seen, you know, or held by your community in that way. In my experience, it's very rare. So I think it is absolutely important. I think that it goes a long way for also giving credibility to a lot of the work that's being done in our sector. I think that it also shines a light on folks, like I said, that likely wouldn't maybe get, you know, an opportunity to share their work or share their perspective. And it adds some humanity too, you know, into the experience. I think the way that the awards conference went, I think was fantastic. I had a really positive experience. Obviously, outside of just winning, I thought it was very well done.
Well, I'm so glad to hear that. It means a lot to us. And it also means a lot to us, the amazing work that you're doing and people like you in the sector. Thank you for your work and for making the nonprofit sector and the communities that we are serving a better place. So congratulations again.
Thank you so much. I really appreciate it.